Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know, I am MD, Doctor of Medicine in Ayurvedic Medicine. That is, I am a consulting Ayurvedic physician. Kaya Chikitsa subject was my specialization. Arthritis was my special topic, rheumatoid arthritis. Okay, and next, I am also MD in Ayurvedic Physiology. For paid online consultation, you are always welcome. I have the expert team of doctors in Ayurveda Academy, and I am the leader, I am the director, I am the coordinator of that academy. So just relax and WhatsApp me on 9226810630 for paid online consultation. The number is also in the description. My dear friends, today's video is a part of Ayurveda in general medical practice or Ayurveda in GP. This is the name of the series that I am conducted since last 1 month. So it is nearly 1 or 2 months because every alternate day you are getting this video at 5:45 in the evening when you are relaxed and after finishing your tea and a little bit snacks. I have the video always for your knowledge and experience sharing. Okay. So today's topic is a painful shoulder. Either it may be the left or it may be the right shoulder. Okay. So you cannot move your hand and you cannot lift your hands and you cannot do the yoga and this and that. But this joint is so important that all the major activities in our life are because of the shoulder joint. So when the shoulder joint is affected, you are like a handicapped person. Okay, but you will not get that problem because I have the very interesting information regarding the causes, investigations, and the treatment. My dear friends, whenever there is a pain, in every video I am teaching you the basic principles of Ayurveda. Pain is related with Vata dosha. So Vata dosha prakopa is the main cause for painful shoulder. Vata dosha prakopa, Vata dosha disturbance is because of the two types. One is Dhatu Kshayajanya, that is a deficiency disorders. It may be Rasa, Rakta, Mans, Med, Asti, Majja, Shukra deficiency. Basically, whenever we are talking about shoulder, there are the muscles, there are the bones, there are the bony joints, there are the ligaments, there are the tendons. So either of these deficiency, Mans Dhatu is not proper Uttama Sarata. The Mans Dhatu quality is of Hina Sarata, bad quality, or the Madhyama Sarata, moderate quality. The Asthi Dhatu is also not properly nourished. That is called as the Asthi Dhatu is a Hinasar Dhatu, low quality of the Dhatu. So Vata dosh on one side and these poor quality of the Dhatus on the other side, and that makes the havoc. Okay, so Ayurvedic treatment of Vata dosha is basically on Snehan and Svedana, but of course, Ahar, Vihar, and Aushadhi, food, lifestyle, and then medicine. Don't forget this. Okay, so Ahar, you should not take the Vata Prakopak Ahar. We are like eating all the time dry food stuff without any beverages, without milk, without water, without fruit juice, without curry, only dry, dry, dry. Salads and puffy, what vada pav and all these samosas, kachoris, and all this whole day or the many days on the only bread and these things. This is very bad. This is very sad also. Okay. So, irregular lifestyle, getting late at night, constipated tendency, all this is bad for Vata dosha because your Vata dosha activity will be hampered. Second thing, your fast life. Fast life is always bad for Vata dosha. Fast food plus fast life is equal to fast degeneration of the cells. And then if you don't follow, fast food plus fast lifestyle, fast death, gone up. So be careful, be careful. Vata dosha problem. And to develop your muscles, to develop your bones, naturally you have to take the Parthiva Gunatmak Ahar. That is a good calcium, good proteins, good iron. Everything is essential. Otherwise, this is one part, Dhatu Kshayajanya Vata. But on the another part, there is a Srotorodh obstruction because of the ama. Ama, what is ama, sir? Ama is like a toxin material created because of the indigestion. So be careful that your digestion, your metabolic process should be well. There should not be constipation. Your appetite should be normal. There should not be loose motions and all these things. Okay. So let us talk about the painful shoulder etiology. First is a referred visceral pains. I just mark for you so that you can concentrate on the matter. Yes, yes, this is special style from Ayurveda Academic channel. Okay, referral visceral pains. That means the pain is not originally here, not originally here or here. It is somewhere else, and that from that place it is attacking on the shoulders. That is called as a referred viscera. Viscera is here in the abdomen. Cardiac pain, whenever you have the heart problem, angina pectoris, it may, or heart attack, you may get pain on the left shoulder also. Then liver or the gallbladder pain is always on the, for example, this is my right shoulder. Whenever I have the cirrhosis, whenever I have the liver problem, I will get pain here. Cholelithiasis, that means stones in the gallbladder, stones of the biles, that will give the pain here also, okay? And diaphragmatic pleurisy can give the pain on both the sides. So original problem is not in the shoulder, original problem in the abdomen, but that pain is referred to the shoulder. So this is very special feature of the pain. You have to learn this particular feature. Local causes, now we are concentrating on the shoulder joint. Frozen shoulder is very common in the middle-aged and old patients. Fibrositis in young patients, that is bicipital tendinitis, subdeltoid bursitis, and supraspinatus tendinitis. These are the three reasons for fibrositis. Next is the cervical spondylosis. I have already uploaded this video. Now, whenever I have talked about the Vata dosha, don't forget about Snehana and Svedana. Snehana is a lubrication or oil. So internally use of ghee and milk, and externally application of the oil. Oil can be applied in different ways for musculoskeletal problems, for neurological problems. All please attention that we have to do Abhyanga, full body oil massage with the warm oil always. Then you can use the Kaya Seka. What is Sir Kaya Seka? It's a pouring of the oil on the local part or full body. That is called as a Kaya Seka. It is also called as a Pidichil in Kerala or Pidichil. The same, Kaya Seka, Pidichil, Pidichil, all are the same words. In Ayurveda, it is called as a Kaya Seka or Parishek. Do you understand? Then fermentation. Fermentation may be because of the local Nadi Sveda. You have to take the pressure cooker, put the plant's crude form, bharadachurna, water, make the decoction, and the fumes, steam will come from the tube and spray over there. Medicated vapor. And then there may be steam boxes, sitting steam box, lying down steam box. So we in Pune, all the facilities of Panchakarma oil massages are available. You are always welcome with prior appointment and prior payments also. Okay. So this is about the Panchakarma. Vata dosha is also controlled by Basti Chikitsa. Basti, especially the depends on the Dhatu Kshayajanya, then Yapana Basti. If it is obstruction, then there may be Lekhana Basti also available in Ayurveda. Okay. So frozen shoulder, I was talking about. Cervical spondylosis, there another separate video is available on my YouTube channel on ankylosing spondylitis, cervical spondylitis. So please check all the playlists. Especially there are two important playlists. One is allopathic medicine treatments, and another is a disease treatment with Ayurveda and allopathy. So both these have a lot of videos and very interesting, simple language but scientific. Then investigations, what you do for the shoulder, X-ray shoulder joint. You have to do the X-ray simple test before doing any MRI, etc. AP and lateral, two views are there, two slides will be there. ECG, electrocardiogram to rule out the cardiac pathology, simple resting ECG, or it may be the treadmill test, stress test. You have to take the ECG when the patient is doing the treadmill. So that is called as a for angina pectoris or ischemic heart diseases. Then LFT, that is liver function test to rule out the liver problems. Now let us talk about the treatment according to the Ayurvedic principles. Number one, Sankhepatah Kriya Yogo Nidana Parivarjanam. The best treatment, first part of the treatment, try to avoid the causes as much as possible. If it is a referred visceral pain, then you should go for liver problem, you should go for gallbladder problem, you should go for pleurisy problem. Treat it and automatically your shoulder pain will be vanish. Frozen shoulder, yes, this is the commonest. Most of the time due to the idiopathic reason, without any cause. Sir, what is idiopathic? Without any cause. Cause is not known, that is called as idiopathic. Okay. Sometimes cure can be obtained without any treatment. Following three stages of the disease and management is of course as follows. First stage of frozen shoulder, that is with pain and with stiffness. There will be both pain and stiffness. Stiffness means I cannot move my hand. Absolutely not. Adduction, abduction, elevation, extension. I cannot do anything. Rotation, no possible. Pain and stiffness. So there you can give Mahavata Vidvamsa, 2 tablets 3 times in a day. from phytopharma company, palsinuron tablet, 1 capsule 3 times in a day. Arnopan, also from phytopharma company, 1 capsule 3 times in a day. Local application over here, myostal liniment from Dudh Papeshwar company, followed by the hot fermentation, only to and fro movement, like this, to and fro, to and fro. That much movement, pendulum like movement is advisable, not any other movements. This is the first stage. Now I am talking about the second stage of the frozen shoulder. Second stage of frozen shoulder, reduced the pain. Pain is reduced, but stiffness increases. Now, each of these stage can be of the days or can be of weeks. For example, every stage, first stage, 4 days, second stage, again 1 week, third stage, again 1 week. But it may prolong like 15 days. First stage, 15 days, second stage, 15 days, third stage, 15 days. Yes, this can happen. Even 1 month, first stage, 1 month, second stage, 1 month, third stage, 1 month. So this disease can be prolonged up to 3 months. Keep it in mind. Then you can properly tackle that particular problem. Now, Vishatindukavati from Jhandu Pharma, 1 tablet 2 times in a day with ghee and warm water. Punarnava Gugulu, which will reduce the Shoth edema, 2 tablets 3 times in a day, to and fro, then above and below movements of the hands to be exercised. Okay. And last stage of the disease is called as a stiffness, but no pain. Stiffness has remained, pain has gone in the third stage. We are talking about frozen shoulder. Punarnavadi Gugulu, 2 tablets 3 times in a day to reduce the Gugulu is a scrapping. So arm will be removed and stiffness will be gradually less and less and less, because stiffness is always related with the Sama Kapha. Sama Kapha gives the stiff joint. So that Samata will be removed by Gugulu. Lakshadi Gugul to strengthen the bony joints, 2 tablets 3 times in a day. Analgesic anti-inflammatory Maharasnadi Kadha, 4 teaspoons with equal amount of water 2 times after meals. Simvanada Gugulu with ricinus oil. This product is with ricinus oil, 2 tablets 3 times in a day. Local application of Mahavishagarbha Taila or Sahachara Taila, followed by steam fermentation. Here, physiotherapy is the most important part in the third stage. Now I am talking about the fibrositis, one of the important cause for shoulder pain. Vata Vidvamsarasa, 2 tablets 3 times in a day. You can see the cursor, my dear friends. Then Triphala Gugulu, especially for the obese people, 2 tablets 3 times in a day. Dashamularishta, Ayurvedic analgesic anti-inflammatory, 4 teaspoons with equal amount of water 2 times after lunch and dinner. Local application of oil, do not rub, followed by short wave diathermy, very specific physiotherapy treatment for fibrositis. So my dear friends, in this video, I have discussed about the painful shoulder, which is a Ekang Vata problem. And I think you have understood the concept. Please don't forget to subscribe my YouTube channel and give me the encouragement to take the efforts on such type of the videos of knowledge and also of interest. Thank you very much. Take care and see you in the next video. Thank you.